I'm joined by Nalin Jain, Senior Revenue Management Consultant at Trinity Health. Nalin is presenting at the upcoming Patient Access Excellence Program taking place November 12th, where he'll deliver a case study on how he's helped Trinity Healthcare evaluate and implement new automation technology in the patient access function. Nalin, thanks so much for coming on today and for sharing your story with us.
Well, happy to be here, Kate. Thank you for that question. My name is Nalin Jain, and I'm a senior revenue management consultant with Trinity Health. The way I got into healthcare is kind of unique. I'm an electronics and electrical engineer by profession, and I come from a family of physicians. Back in my college days, I was working on microprocessors, which are the heart of all our microcomputers. And I said, how little healthcare is, how little technology is getting used in healthcare. So wouldn't it be great if we create something electronic that will be leveraged in the healthcare space? So I wrote a thesis on using microcomputers in the healthcare space. I developed a prototype for a cardiac output monitor using microprocessors. And the advantage of that is that non-invasively, you can look at how well your heart is performing by measuring the cardiac output and thereby determine the health of the heart. And so when Burroughs Corporation came calling for jobs, they looked at my resume, and the only thing there was my thesis in healthcare. And they said, we are picking you up and you're going to be in our healthcare vertical. So that's how I got my start in '85, and I never left healthcare since then. Now, through these, oh gosh, it's been a long time, 25 and 15, almost 40 years. I have played various roles. I'm a technical technologist at heart. And during the last 15, 20 years, I've been more on the business side of healthcare. So working with our revenue cycle, patient access, and patient financial services departments. Through my career, I've had multiple companies that I worked with. I worked as a consultant. One of the most fulfilling part of my career was back in 1999 during the dot-com boom. I started my own company in the healthcare space called clinicmanager.com. And the essence there was to make sure that the physician is able to focus on patient care as opposed to doing all the paperwork. So my solution would come in and drive efficiencies in the healthcare space by automating a lot of claims processing, claims, development, so on and so forth, appointment scheduling and whatnot. Unfortunately, we were like 5, 6, 10 years ahead of our times. We didn't get the traction in the market. I sold my company and I became a consultant in the healthcare space. And that's the other part of my long career where I gotten the most fulfillment. I have consulted with healthcare organizations of all types, payers, life sciences companies, mostly providers, both hospitals and physicians across the country, literally from Seattle to Miami and from San Fran to Boston. The last 10 years I've been with Trinity. Trinity Health is my employer, and I play the role of senior revenue management consultant. My focus is on digital health technology, so on and so forth.
Super. And you've done some really interesting work helping the team at Trinity to build strong governance structures that help the group to identify, where, when, and how automation and technology can be integrated into those patient access workflows. And you'll be sharing that case study at the upcoming meeting. Can you give us a little preview of what you'll be discussing?
Yes, I think the cornerstone of my case study would be on how to effectively stand up a very practical program for automation. And when we say automation, we don't simply mean robotic process automation. We also include within this realm anything that has to do with technology, either available technology that you already have within the EHR that you have, or other adjacent technologies. So our automation program is a little bit more encompassing. And the reason for that will be clear as we walk through some of the components of how to stand up an effective program for automation. I think first and foremost, it's very important, and we'll touch upon this, on how to create the program structure. So across your revenue cycle areas, starting with patient access, obviously, the mid-revenue HIM coding and back-end operations, including patient financial services, billing follow-up, cash posting, denial management, kind of corral all of them together into a cohesive unit, and across departments have participation so that you create a structure that can support with A, visioning your case studies, your cases for automation, B, creating a process of qualifying these use cases so that they become eventually a standard executable project. And then lastly, the project work groups, so that the team that is working on executing upon those projects can successfully complete those automation cases. So structuring of the program is important. I think another important aspect of standing up an effective program is the part of governance. Governance plays a huge role. Oftentimes I've seen, and I say this based on wisdom, I've seen healthcare organizations chase the shiny, bright thing. Obviously, there's a lot of buzz in the market about RPA and AI, and the technologies do work. But we need to find the right segment, the right avenue, the right sliver where those technologies can be leveraged within our organizations. And each organization is different. For example, we are in the process of going to a common electronic health record. So it's a massive effort for 100+ hospital system. Other organizations may be in different stages of their evolution with regards to technology, but having a strong governance would make sure that you are effective stewards of the resources that have been entrusted to you. That's number two. And then the third aspect of standing up a good, effective program is to really ensure that you're able to define what success would look like. So, the return on investment from a potential automation of a case, of a use case, and those discussions, even though we start to measure them as the third component, they're often our very first thing that we address when we are qualifying a use case all the way from the drawing board to the project execution phase. Effective governance is very important, and and walking that use case through all the qualification funnels is a must.
Completely agree. And patient access and revenue cycle teams have so many different challenges that they're addressing. What is one piece of advice or one recommendation that you would give to people who are tackling this difficult work?
So I have always viewed automation as, a lot of people fear the word RPA and bots. I think the obvious thought that goes through their minds is it's going to result in job losses, that robots are going to take jobs away. My viewpoint is 180 degrees different. I believe that a responsive automation is about taking the robot out of human beings. We as human beings were born to use our cognitive abilities to do better things, not to punch the keyboard the same way 100 times every single day. So we were meant to do bigger and better things. Unfortunately, because of how job descriptions have been siloed, you still have somebody who comes in and all they do is claim statusing day in, day out, hour in, hour out. And if you look at that case and you look at the burnout that occurs as a result of that, the attrition that occurs as a result of lack of job satisfaction, I think those are powerful drivers to start to consider how can you, as the governance body of an automation program, take that robot out of the human being and displace them to higher value jobs. So a part of our governance process actually talks about at the very inception of the program or at the very inception of qualifying a use case, if it is resulting in release of FTEs, so if an automation is going to release X number of FTEs, what is the plan to leverage those FTEs on a higher value work? I think tying the two together, we can all, implement a very practical automation program. So that's my advice to anybody who's wanting to get deep into RPA automation, that it's not about replacing human beings. It is about releasing them to higher value work. And again, as a corollary to that, I'll add that unlike the back-end operations, which is kind of a commodity, right? I mean, you can centralize patient financial services into a building. Patient access is still very local. So if you're operating in multiple states like we do, patient access is still very fragmented. So you need to look very carefully at what those functions are that can be centralized and automated. You don't want a bot to run 50 different times in 50 different hospital locations. So there are functions right from scheduling, registration, financial clearance, prior auth, that can be done centrally from a patient access perspective. So the focus should definitely be on those processes that are more standard than others.
And I think it's also, as you and I had talked about before, it's about keeping the patients really at the center of these decisions and thinking about how can we deliver that higher level, that care that we need to do.
That 100% correct. So when I talk about colleague experience or employee satisfaction, and the other part of that coin, the other side of that coin is the patient. We are here because of our patients. And if we are not able to enhance their experience using technology, whether it's RPA or otherwise, we are going to shortchange our patients. So 100% in agreement with that, Kate.
Well, thank you so much, Alan, for joining us today. And we really look forward to the discussion coming up in November and appreciate your time. Thank you so much.